Welcome to Worldwide Business. I'm Kathy Ireland. According to a recent Mayo Clinic report, more than half of U.S. physicians are now experiencing professional burnout. Doctors and their staff are working longer hours, squeezing more patients into already overloaded schedules to collect less each year from insurance carriers. SmartMD has positioned themselves to be a vital partner to medical professionals, and CEO Nandeep Katari is here to explain how they can help. Welcome, Nandeep.
Thank you, Kathy.
Nandeep, can you please explain the challenges that practices face trying to be reimbursed by insurance carriers?
Yeah, physician burnout is caused by a number of factors, but a key contributor is the cumbersome reimbursement cycle. And more recently, what we're seeing is that insurance carriers are flat out denying claims, requesting additional information, or doing audits. And this is creating even more paperwork for these frustrated and tired employees. And so what we're seeing is a lot of physicians are basically not even responding and foregoing all of that income. So our first goal is to reduce some of that physician and staff stress. The way we do that is by helping the medical clinic address this ever-growing demand for paperwork and documentation from the insurance carriers. Basically, we come in and teach the staff how to meet this requirement without working crazy hours.
Could you please share a customer story of how SmartMD has made an impact on a medical practice?
I think Innovate is a great example of the kind of work that we can do for a clinic. We worked closely with Al and Scott to put in place process, technology, and the supporting staff so that they can focus on taking care of these really sick patients. I mean, they're focused on neuromuscular disease like Lou Gehrig's. These are complicated conditions. And we've done it in a way that they can really take care of their patients. They can get paid for that work without having to work insane hours.
Right. In this Worldwide Business Field Report, we examine SmartMD and their streamlined solutions for medical practices.
It seems that many of our electronic medical records and a lot of the new electronic systems are distracting from the direct interaction with the patient. So the trick with SmartMD has been that we are able to integrate the narrative portion of our thinking, the dialogue with the patient, into the technology. We're able to utilize an iPhone, an iPad, even the larger iPad, which allows us to integrate with the technology just as if we were writing on a piece of paper.
Well, one thing that distinguishes SmartMD from the other electronic medical record systems is the transcription capabilities. I'm able to go into a room with a patient without a computer and just talk to that patient, and then synthesize that information later and transcribe that into a narrative report that reads well and has a lot of detail in it and isn't just a series of checkboxes like a lot of other electronic medical record notes are. With SmartMD, I'm able to transcribe that information later and formulate it into a well-written, easy-to-read narrative report.
Nandeep, please give us a little background on SmartMD.
Yep, so we've been around since 1999, and we've been helping physicians and their staff prepare clinical documentation to substantiate claims. And more recently, in the last 6 years, we've actually been helping doctors get paid on those claims. In a broader sense, what we do is that we are what's known as a technology-enabled service provider, which means that we provide services to the doctor, and then we back it up with leading-edge technology. As we saw in the field report, Dr. Heller was using our new app for the iPad Pro that uses the Apple Stylus. For doctors who love the simplicity of pen on paper, this is the perfect replacement.
And can you please describe the various services SmartMD provides?
Sure. When we go into a clinic, we effectively look at the whole problem and we basically fill in the gaps. So it's process, people, and technology. If the staff is either overloaded, they don't have enough time to deal with these demands from the insurance carriers, or they can't afford to hire a full-time employee, we'll fill in with our staff. If their processes need to be revamped, we'll institute best practices. And if their technology is missing, or worse, is inefficient, we'll augment with some of our own.
And Nandip, if a medical office believes they have a good coder, can you explain why SmartMD would be necessary?
Yeah, so in 2014, the industry adopted the ICD-10 coding standards. It was painful, but there were two upsides to it. Most billers went to school and got retrained on the latest coding standards. Most practices actually went out and bought new billing software which had coding algorithms in them. The upshot is that most claims are pretty clean and well coded. The problem is that the game has changed now. Insurance carriers are looking for documentation. Without it, they're not going to pay on the claim. So clean code doesn't mean as much as it used to anymore.
And could you please highlight the advantages for a practice of outsourcing billing to the same company that does their transcriptions?
Yeah, again, it boils down to time and effort. If you have multiple parties or multiple vendors that are supporting the clinic, then the practice has to do all the work of coordinating the work.
Right.
And when it's all outsourced to one organization, like it often is to us, we take care of all of that. It just reduces the amount of work for the staff and also keeps things moving along.
It looks like SmartMD can really help take some of the stress out of the revenue cycle and bring some sanity back to the clinic. Nandip, thank you so much for joining
Kathy.
us. Thank you. Continued success to you.
Thank you.
Thank you. And thank you for watching. For Worldwide Business, I'm Kathy Ireland.